Welcome back to MCQs Master 101, where average studying ends and Nclex mastery begins. Today we're tackling 50 heart failure Nclex questions you must be able to answer under pressure. Not basic recall, not classroom theory, real exam-level clinical traps. We're talking acute versus chronic heart failure, left versus right-sided failure, medications that reduce mortality, digoxin toxicity, pulmonary edema emergencies, and those who do you see first priority killers. If you can survive this set, you're thinking like an RN, not a student. Grab your notebook, pause when needed, think before you answer, and remember, on Nclex, safety beats speed. Let's go. Question 1. A client with acute decompensated left-sided heart failure reports sudden dyspnea and cough. Which assessment finding requires immediate action? A. Bilateral crackles at basis. B. Pink frothy sputum. C. 2+ pitting edema. D. S3 heart sound. Correct answer, B. Pink frothy sputum. Rationale indicates acute pulmonary edema, life-threatening airway compromise. Question 2. A client with chronic heart failure is taking furosemide. Which lab value requires immediate provider notification? A. K plus 3.1 MEQ per liter. B. Na plus 138 MEQ per liter. C. Creatinine 1.0 milligrams per deciliter. D. HGB 14 grams per DL. Correct answer, A. K plus 3.1 MEQ per liter. Rationale, loop diuretics cause hypokalemia, risk of fatal dysrhythmias. Question 3. Which finding suggests worsening right-sided heart failure? A. Orthopnea. B. Elevated jugular venous distension. C. Bibasilar crackles. D. Paroxysmal nocturnal dyspnea. Correct answer, B. Elevated jugular venous distension. Rationale, systemic venous congestion equals hallmark of right-sided failure. Question 4. A client with HF-REF, EF 30%, is prescribed carvedilol. Which assessment finding is most concerning? A. HR 58 BPM. B. BP 118 over 70 mmHg. C. Weight gain of 1 pound per day. D. Mild fatigue. Correct answer, A. HR 58 BPM. Rationale, beta blockers depress HR. Bradycardia may require dose adjustment. Question 5. A nurse evaluates effectiveness of IV furosemide in acute HF. Which finding indicates improvement? A. Decreased crackles. B. Increased BP. C. Decreased urine output. D. Increased JVD. Correct answer, A. Decreased crackles. Rationale, reduced pulmonary congestion equals therapeutic effect. Question 6. Which medication reduces mortality in heart failure? A. Digoxin. B. Furosemide. C. Lisinopril. D. Hydrochlorothiazide. Correct answer, C. Lisinopril. Rationale, ACE inhibitors improve survival and reduce remodeling. Question 7. A client with HF reports weight gain of 3 pounds in 24 hours. What is the priority action? A. Encourage fluids. B. Notify provider. C. Restrict sodium only. D. Document and reweigh tomorrow. Correct answer, B. Notify provider. Rationale, rapid weight gain equals fluid retention equals possible exacerbation. Question 8. Which symptom most strongly indicates left-sided heart failure? A. Hepatomegaly. B. Ascites. C. Dyspnea on exertion. D. Peripheral edema. Correct answer, C. Dyspnea on exertion. Rationale, pulmonary congestion is hallmark of left HF. Question 9. A client with HF is on digoxin. Which finding suggests toxicity? A. Yellow vision. B. Hypertension. C. Polyuria. D. Tachycardia. Correct answer, A. Yellow vision. Rationale: visual disturbances equal classic digoxin toxicity sign. Question 10. Which diet instruction is most appropriate for chronic HF? A. Increase potassium-rich foods only. B. Restrict sodium to 2 grams day. C. High-protein unrestricted diet. D. No fluid restriction needed. Correct answer: B. Restrict sodium to 2 grams day. Rationale: sodium restriction prevents fluid retention. Question 11. A client with acute pulmonary edema is extremely anxious and tachypneic. Which prescription should the nurse implement first? A. IV morphine. B. IV furosemide. C. High-flow oxygen. D. Sublingual nitroglycerin. Correct answer: C. High-flow oxygen. Rationale: airway and oxygenation are priority before medication administration. Question 12. Which assessment finding most strongly suggests cardiogenic shock secondary to severe heart failure? A. BP 86/52 millimeters of mercury. B. Crackles in lungs. C. Peripheral edema. D. S3 heart sound. Correct answer: A. Severe hypotension with HF indicates impaired cardiac output to shock. Question 13. A client with chronic HF is prescribed spironolactone. Which lab value requires intervention? A. Potassium 5.8 milliequivalents per liter. B. Sodium 136 milliequivalents per liter. C. Creatinine 0.9 milligrams per deciliter. D. Hemoglobin 13 grams per deciliter. Correct answer: A. Potassium 5.8 milliequivalents per liter. Rationale: potassium-sparing diuretic, hyperkalemia risk. Question 14. Which finding indicates worsening left ventricular failure? A. Decreased urine output. B. Clear lung sounds. C. Warm extremities. D. BP 128/76 millimeters of mercury. Correct answer: A. Decreased urine output. Rationale: reduced renal perfusion reflects declining cardiac output. Question 15. A client with heart failure is prescribed digoxin 0.25 milligrams daily. Apical pulse is 54 BPM. What should the nurse do? A. Administer medication. B. Hold dose and notify provider. C. Recheck pulse in 2 hours. D. Give half dose. Correct answer: B. Hold dose and notify provider. Rationale: digoxin is held if HR less than 60 BPM to prevent toxicity. Question 16. Which finding suggests improvement after initiation of ACE inhibitor therapy? A. Increased BNP. B. Reduced afterload. C. Increased peripheral edema. D. Worsening cough. Correct answer: B. Reduced afterload. Rationale: ACE inhibitors decrease vascular resistance, ergo improved cardiac output. Question 17. A client with HF develops new onset confusion. What is the priority assessment? A. Serum sodium. B. Oxygen saturation. C. Daily weight. D. Intake and output. Correct answer: B. Oxygen saturation. Rationale: hypoxia from pulmonary congestion may cause acute confusion. Question 18. Which symptom is most characteristic of right-sided heart failure? A. Pulmonary crackles. B. Frothy sputum. C. Hepatomegaly. D. Orthopnea. Correct answer: C. Hepatomegaly. Rationale: systemic venous congestion leads to liver enlargement. Question 19. A client with HF reports needing 3 pillows to sleep. This finding is best documented as A. Paroxysmal nocturnal dyspnea, B. Orthopnea, C. Nocturia, D. Sleep apnea. Correct answer, B. Orthopnea. Rationale: dyspnea when lying flat requiring pillows defines orthopnea. Question 20. Which finding indicates fluid overload in a client with HF? A. Weight loss 2 pounds, B. Flat neck veins, C. Bounding pulses, D. 3+ pitting edema. Correct answer, D. 3+ pitting edema. Rationale: significant peripheral edema indicates excess fluid retention. Question 21. A client with HF has BNP of 1200 picograms per milliliter. What does this indicate? A. Improved cardiac function, B. Severe ventricular stretch, C. Dehydration, D. Electrolyte imbalance. Correct answer, B. Severe ventricular stretch. Rationale: BNP rises with ventricular volume overload. Question 22. Which medication should be avoided in acute decompensated HF? A. Metoprolol Newstart, B. Furosemide, C. Nitroglycerin, D. Oxygen. Correct answer, A. Metoprolol Newstart. Rationale: beta blockers are not initiated during acute instability. Question 23. Which finding suggests digoxin toxicity? A. Nausea and vomiting, B. Hypertension, C. Increased appetite, D. Polyphagia. Correct answer, A. Nausea and vomiting. Rationale: early sign of digoxin toxicity. Question 24. A client with HF develops atrial fibrillation. What complication is most concerning? A. Stroke, B. Hypoglycemia, C. Hypernatremia, D. Pneumonia. Correct answer, A. Stroke. Rationale: AF increases risk of thromboembolism. Question 25. Which finding indicates cardiopulmonary improvement? A. Decreased respiratory rate, B. Increased crackles, C. Weight gain, D. Elevated BNP. Correct answer, A. Decreased respiratory rate. Rationale: reduced pulmonary congestion improves breathing. Question 26. A client reports dry cough after starting lisinopril. What is the cause? A. Bradykinin accumulation, B. Fluid overload, C. Hypokalemia, D. Pulmonary embolism. Correct answer, A. Bradykinin accumulation. Rationale: ACE inhibitors increase bradykinin, persistent cough. Question 27. Which lab finding is expected in advanced HF? A. Elevated creatinine, B. Low BNP, C. Hypercalcemia, D. Low hematocrit. Correct answer is A. Elevated creatinine. Rationale: decreased renal perfusion from poor cardiac output. Question 28. Which client statement indicates correct understanding of HF management? A. I will drink as much water as possible, B. I will weigh myself daily, C. Salt substitutes are safe, D. I can stop medications when I feel better. Correct answer is B. I will weigh myself daily. Rationale: daily weight detects early fluid retention. Question 29. Which finding is most concerning in HF? A. HR 102 BPM, B. BP 130 over 84 millimeters mercury, C. O2 sat 88%, D. Mild fatigue. Correct answer is C. O2 sat 88%. Rationale: hypoxemia requires immediate intervention. Question 30. Which medication improves contractility in HF? A. Digoxin, B. Lisinopril, C. Spironolactone, D. Losartan. Correct answer is A. Digoxin. Rationale: positive inotropic effect increases cardiac contractility. Question 31. A client with HF has cool, clammy skin. This indicates A. Improved perfusion, B. Sympathetic activation, C. Fluid deficit, D. Hyperthyroidism. Correct answer is B. Sympathetic activation. Rationale: compensatory vasoconstriction due to low cardiac output. Question 32. Which assessment suggests pulmonary edema? A. Wheezing, B. Pink frothy sputum, C. Dull chest pain, D. Dry cough. Correct answer is B. Pink frothy sputum. Rationale: classic sign of alveolar fluid accumulation. Question 33. A client with HF reports nocturia. Why does this occur? A. Supine position improves renal perfusion, B. Dehydration, C. Hyperkalemia, D. Decreased ADH. Correct answer is A. Supine position improves renal perfusion. Rationale: fluid returns to circulation when lying down. Question 34. Which medication reduces preload in HF? A. Nitroglycerin, B. Digoxin, C. Dopamine, D. Dobutamine. Correct answer is A. Nitroglycerin. Rationale: vasodilation decreases preload. Question 35. Which finding indicates worsening HF? A. Weight gain 4 pounds in 2 days. B. Clear lung sounds. C. HR 76 BPM. D. BP 118/70. Correct answer A. Weight gain 4 pounds in 2 days. Rationale: rapid fluid accumulation signals exacerbation. Question 36. Which electrolyte imbalance increases risk of digoxin toxicity? A. Hypokalemia, B. Hypernatremia, C. Hypercalcemia, D. Hypermagnesemia. Correct answer A. Hypokalemia. Rationale: low potassium enhances digoxin binding toxicity. Question 37. A client with HF develops sudden chest pain and dyspnea. What complication is suspected? A. Pulmonary embolism, B. Hypoglycemia, C. Hyperkalemia, D. UTI. Correct answer A. Pulmonary embolism. Rationale: HF increases clot risk due to stasis. Question 38. Which medication class decreases ventricular remodeling? A. ACE inhibitors, B. Loop diuretics, C. Cardiac glycosides, D. Nitrates. Correct answer A. ACE inhibitors. Rationale: prevent pathologic cardiac remodeling. Question 39. A client with HF reports dizziness when standing. Likely cause? A. Orthostatic hypotension, B. Hypervolemia, C. Hypoxia, D. Infection. Correct answer A. Orthostatic hypotension. Rationale: vasodilation from medications may cause BP drop. Question 40. Which sign indicates decreased cardiac output? A. Confusion, B. Warm skin, C. Strong pulses, B. Polyuria. Correct answer A. Confusion. Rationale: cerebral hypoperfusion from low output. Question 41. Which action is priority during acute HF exacerbation? A. Position client upright, B. Encourage ambulation, C. Increase oral fluids, D. Administer beta blocker. Correct answer A. Position client upright. Rationale: high Fowler's reduces preload and improves ventilation. Question 42. Which medication reduces mortality in HFrEF besides ACE inhibitors? A. Beta blockers. B. Digoxin. C. Furosemide. D. Dopamine. Correct answer: A. Beta blockers. Rationale: reduce sympathetic overactivation and improve survival. Question 43. Which finding indicates right ventricular failure? A. Ascites. B. Crackles. C. Orthopnea. D. PND. Correct answer: A. Ascites. Rationale: fluid backs up into systemic circulation. Question 44. Which lab value correlates with fluid overload? A. Low hematocrit. B. High hematocrit. C. Low WBC. D. Low platelets. Correct answer: A. Low hematocrit. Rationale: hemodilution from excess fluid. Question 45. Which medication requires potassium monitoring? A. Furosemide. B. Nitroglycerin. C. Morphine. D. Oxygen. Correct answer: A. Furosemide. Rationale: causes potassium loss. Question 46. A client with HF becomes suddenly hypotensive after nitroglycerin. What is the cause? A. Reduced preload. B. Increased afterload. C. Hypervolemia. D. Cardiac tamponade. Correct answer: A. Reduced preload. Rationale: venodilation decreases venous return, blood pressure drop. Question 47. Which sign indicates severe fluid overload? A. Crackles throughout lungs. B. Dry mucous membranes. C. Tachycardia only. D. Weight stable. Correct answer: A. Crackles throughout lungs. Rationale: widespread pulmonary congestion. Question 48. Which client is at highest risk for HF exacerbation? A. Consumes high-sodium diet. B. Exercises regularly. C. Weighs daily. D. Limits fluids. Correct answer: A. Consumes high-sodium diet. Rationale: sodium increases fluid retention. Question 49. Which finding requires immediate intervention? A. O2 sat 84%. B. Mild edema. C. HR 92 beats per minute. D. BP 124/78. Correct answer: A. O2 sat 84%. Rationale: severe hypoxemia is life-threatening. Question 50. Which clinical finding most strongly indicates progression of heart failure? A. Increasing fatigue. B. Stable weight. C. Clear lung sounds. D. Normal BNP. Correct answer: A. Increasing fatigue. Rationale: reflects worsening low cardiac output. If you made it through all 50, that's elite discipline. Heart failure questions are never just about symptoms. They test oxygenation, perfusion, electrolytes, medication safety, and priority thinking. If you struggled, good. That means we exposed your weak spots before the exam does. If you scored high, even better. You're building RN-level clinical judgment. Don't forget, subscribe to MCQs Master 101. Like this video, drop your score in the comments, and tell me which topic you want next, because we don't guess on this channel. We prepare, we master, we pass. See you in the next one.